World's population is overweight, according to a new worldwide obesity study. Research by the consultancy firm the McKinsey Global Institute puts the annual cost of obesity at about £1.3 trillion. The UK's bill alone is estimated to be £47 billion a year. The report says money could be saved by controlling portion sizes. Well, let's go live to Geneva. We can talk to Dr. Temo Waqanivalu. He's part of the Diet and Physical Activity Surveillance and Population-Based Prevention Unit at the World Health Organization. Thank you very much for joining us. So do you think portion size is the key?
Yes, indeed. Portion sizes, we've established that that diet and physical activity, evidence proves that diet and physical activity are the main contributors to obesity, and so when you get to diet, portion sizes definitely does matter.
Have people lost sense of what a portion size should actually be?
Yes, I mean, and this is something that we've established, that the environment that the countries and governments establish is absolutely important for obesity. We've estimated that 65% of world's population live in countries where overweight and obesity kills more people than underweight, and it's due to the environment that we create. Portion size in certain countries is definitely different from the perception of a portion size in others, and that contributes to this worldwide epidemic.
The report also says that public health campaigns and taxes on foods aren't as helpful as other ways of controlling obesity. Aren't they the only way to actually get these messages across to people?
We've always stated, WHO, that we need a comprehensive approach to obesity. We need a whole of government and a whole of society. No single approach is the key. There's no real magic bullets per se. We need a comprehensive approach that looks at a life course perspective as well. We've established through current evidence that nutrition in early childhood and even in pre and postnatal is important for this, and government needs to create the right food environment. So a combination of some of the efforts countries are doing in terms of taxes, the marketing of foods and non-alcoholic beverages to children has powerful effect that actually lends children to these habits, and so some of these measures are important, but the settings as well that we create, the environment in schools and communities that we create that could lend people to actually practice the behavior that could help improve and prevent obesity. The key message is obesity can be prevented, and if we create the right environment by government's leadership, contributing work by the food industry, by consumers, and the population-wide approach is important in this approach, and no single message, no single campaign could actually do the job.
In the end, does it just come down to personal responsibility? You say obesity can be prevented, everybody knows that. It's down to people taking responsibility for themselves in the end, isn't it?
Not really. And again, I re-emphasize, there used to be the perception this is an individual thing and that it's up to the individual and the individual needs to be blamed. But the environment that is created around the individual to be able to eat healthy food, to be able to do physical activity by the planning and the environment that's created, that's not really the individual responsibility, and it requires a corporate and a whole government responsibility. So again, not the individual to be blamed, but the whole society and the whole of government needs to take a comprehensive approach to this.
Dr. Temo Waqanivalu from the World Health Organization, thank you very much. The award-winning